My first guest is Professor Bhramar Mukherjee, epidemiologist at the University of Michigan, handles data scientist in the chair there. Appreciate you joining us, Bhramar, because you've been tracking this, Professor, for a very long time. When you see the report now of the World Health Organization suggesting that the actual estimate of deaths is almost 10 times the number the Indian government gave, 5.23 lakhs versus 47 lakhs, do you agree with this estimate about COVID deaths, or has WHO got this horribly wrong, given the fact that its methodology still seems a little unclear and non-transparent?
So thank you for that question. I'm not surprised by the WHO estimates because, as you all know, there have been several estimates trying to predict the excess mortality in India using different approaches. The Economist model gives an estimate of around 4.86 million. The IHME estimate is around 4 million. And now the WHO estimate is another evidence towards similar in the ballpark, around 4.74 million. So I do think that these are largely consistent, and I have to declare that I was a part of the WHO technical advisory group. And what I'm saying is really an independent statistician, that all of these estimates came from different methodology. But it seems like all roads point to Rome, and there is some consistency in terms of this excess mortality estimate.
You know, it's interesting you're saying you are part of the WHO advisory group on this, because then you are in a better position to tell us how WHO came at this figure, because India is saying the study is based on a model that has been created without authentic data, that the WHO study went to 17 states and took these numbers based on what websites and reports in some instances have said. In a country as diverse as India, you can't have a one-size-fits-all approach, and a model cannot be extrapolated for the entire country based on what you saw in certain states. Are these deaths therefore simply an estimation and therefore not accurate, and in some cases the WHO may have exaggerated the numbers?
So that criticism is actually unfair and untrue. Because the model for there was a lot of models in the WHO report, because different countries have different levels of data available. Unfortunately, India only has data available at a subnational level. The all-cause mortality data, which many countries have released week by week in 2020 and 2021, will really give us a more granular picture. Because as you see, excess mortality is not just COVID deaths. It's really COVID deaths, reported COVID deaths, and then missed COVID deaths, which happened in most countries. And there is nothing to be embarrassed about, because it's very hard to capture. And then there is death from other causes, which due to the pandemic, certain human and behavioral forces have shifted. And then there is long-term effect of COVID. A lot of people died within a year because of cardiac events and respiratory crisis. So all of that put together is the excess mortality, which is the global toll of the pandemic. And for the model for India, did not really use Indian data. It's not like it was developed from other countries and just transported to India. That's not the case. And as I said, that not just the WHO model, different methodology, different models all point to sort of seem in the same ballpark. So I do think that this is a credible estimate, and several experts have reviewed this methodology.
No, you're calling it a credible estimate, but India released, Professor Mukherjee, the death registration numbers of 2020. They show about 5 lakh excess deaths. Now, you know those death registration numbers nowhere match up to 4.7 million deaths or 47 lakhs. So prima facie, somewhere your death registration numbers, your compensation claims should at least match up to what the government says. In that sense, some may say underreporting, yes. But is it of the scale that you are claiming? It's the scale. You're claiming a virtual 9x scale. The WHO is claiming a 9x scale.
So the thing is that, in 2020, India just released the data. in 2021 is when the acute second wave happened. That's when most of these estimates happen. But you also have to remember that it's not just the COVID-related deaths we are talking about. I think there is a confusion about that. Obviously, this total mortality COVID, we believe, is a very large driver of this percentage. But there could be deaths related to other causes as well. If the COVID death reporting have been correct, then we have to sort of point to that if there has been really these excess deaths, then there has been a real collapse and stress on the healthcare system. And so many other people died because of additional causes to COVID.
No, 1 minute. 1 minute, ma'am. Let me get this clear. What you're now saying, Professor Mukherjee, is that this number that the WHO has put up of 4.7 million deaths doesn't necessarily include COVID deaths alone, also includes those who may have been deprived of medical facilities because the entire focus was on COVID, and to that extent, their numbers have also been added. So therefore, when WHO now says excess mortality because of COVID, isn't that a little unfair or unclear? Because then the general impression is that there were 47 lakh COVID deaths. Now what you're saying, not all of them may be because of COVID-related reasons. Am I correct?
So yeah, that's something that we really have to understand this measure. Excess mortality is really the total toll of the pandemic. And because the pandemic was largely driven by COVID, COVID is a substantial chunk of the deaths. But we cannot attribute all of those deaths to COVID because we do not have very detailed cause-specific mortality data. This is also true for other countries. What we are seeing is that it is really a conglomeration of other deaths that happened as well, as you said, that there could be deaths even averted, right? Because there's less mobility, so maybe road accidents went down. But there could be increased deaths due to mental health. There could be increased death due to lack in care, access to transportation. So all of these barriers could lead to additional mortality as well. So we really have no way to tease apart the three buckets that missed COVID deaths, long-term effects of COVID, and what happened due to the pandemic shift. So we have to, but in most of the countries, COVID, direct and indirect, caused this stress on the healthcare system. So if we accept that the COVID reporting numbers are very correct, then we have to accept that the healthcare system really collapsed and the effect of the pandemic is still very severe. And it has led to a lot of family members and a lot of people.
Interesting you're saying, therefore, it's direct and indirect COVID-related deaths, but there will be those again, Professor Mukherjee, who will just question the credibility of the World Health Organization right from the start of the pandemic. The fact that they seem to delay the warning the world, that they've been very soft on China in particular, and here you've got a situation where India is being accused of hiding deaths, and we still don't know what the actual numbers in China are, and the WHO doesn't seem to be doing enough. Instead, they seem to be masking China's death while targeting India, is one of the concerns expressed by officials here.
So I do not think, I am not a politician and I'm not a representative of the WHO, so I cannot talk about country-specific relationships. But if you look at all of these global papers that have come out, the IHME paper, that the WHO estimates, I do not think anybody is targeting India. Everybody is trying to do the best job that they can with the data that are available. I do not think that there is a problem with all of these different mathematical models. For example, the Economist model uses many covariates and uses machine learning, and it's completely different than the WHO model. And similarly, the IHME model is also quite different. So I feel that there is not much wrong with these mathematical models. We really need to improve the data that is being fed to this model and have more complete data.
But let me for a moment stick to China. A country of 140 crore people officially reported to the WHO just 11 lakh infections, 15,350 deaths from 3rd January 2020 to 5th May 2022. Doesn't that sound prima facie clear case of underreporting? Shouldn't that also have been part of a global report like this that the WHO releases, including instead of suggesting that actually China did not underreport?
Absolutely. I think that if you look at the underreporting, Pakistan, Bangladesh, many countries in South Asia have a huge underreporting factor. So I do think that there is a real problem with capturing COVID deaths, and countries should really work with WHO to improve their death reporting, to improve the civil registration number, crowdsource other data related to death so that we can have a real proper tracking of a very important public health metric. I don't think that it is only targeting India at all. It has become a big news in India because of the resistance and the back and forth. But it is true that many countries have failed to capture COVID deaths and accurate death reporting during the pandemic.
But given that, given that there is still questioning over the manner in which data has been gathered in this COVID period, shouldn't WHO itself have been more cautious while putting out these figures with such authentic, claiming they were authentic? Because this, if you throw these figures at people, it can create panic. A government says 5.23 lakhs, the World Health Organization says 47 lakhs. Shouldn't an organization like WHO be a little bit more cautious? Acknowledge that there is actually a lot of scientific data variability. There is no accuracy to any numbers.
So if you read the scientific paper, I do think that there have been lot of caution, lot of sensitivity analysis done. The subnational data, what is the contribution of each of the state to the estimation? Lot of care have been taken to put forward these estimates. And I think it's our responsibility to communicate with the public that the COVID reported numbers are only a part of it. This is really measuring the total toll of the pandemic, which is the net difference between the mortality that you would have expected had the pandemic not happened with the what you are seeing right now. And if the observed data was available, that would be the best. So I'll strongly sort of urge communities, countries to really interpret the data well and come up with a more bolstered system. For example, Dr. Prabhat Jha mentioned that you can add a question to your next census, that how many people in the family or household died. I also want to say that this is not just the WHO estimate. The paper by Prabhat Jha's group, which got published in Science, has 3 sources of data: a voting survey plus a healthcare facility death survey. They also point to this kind of underestimation. The Economist model also point to similar kind of underestimation. So you can criticize all the models, but this is what is the best available estimates are. And as scientists and statisticians, we are putting forward the best set of estimates with clear, transparent assumption, publicly available code, and the data that were used. So I think that it is really a scientific discourse.
You seem to be suggesting, therefore, that the numbers are underreported. Therefore, I will ask you and put you on the block in a way, Professor Mukherjee. Your estimate, 4x, 5x, 9x, what, according to you, based on what you've gone through the data, is the most accurate estimate then of underreporting of COVID deaths?
So, we did a paper which is published on meta-analysis. We reviewed many studies which have come up with this death estimate for India. Some are really COVID-specific deaths, and some are really this excess mortality. So it's hard to decouple between the two, but the range lies between 4 to 5 to 10. So there is incredible heterogeneity. But more and more, with more data coming in for the 2 years of 2020 and 2021, it seems like more of the studies are pointing to 6 to 8, 6 to 9, that range. But again, you have to understand the underreporting of COVID and the excess mortality are 2 different metrics that we are looking at.
So in conclusion, how are we going to resolve this? Do we need a COVID commission, maybe of independent experts who sift through all the data that the government provides, work with the Indian government, rather than the collision course we are seeing now between WHO and the government of India?
I absolutely think that, this is a problem that many countries face, not just India. So this really presents an opportunity for us to really look at the civil registration system publicly, and at a time of really acute crisis, and make it stronger with the information technology and the data science systems that we have in place. We really need more resilient public health data systems in a pandemic and beyond.
Professor Bhramar Mukherjee joining me there from the University of Michigan. You were an advisor to that WHO body, so your words carry a lot of authenticity, or at least give us that perspective. I appreciate.